Hi team, it's Pete here from MedicFX. I'm the medical and technical advisor for the MedicFX team. A lot of the stuff comes through me so that I can validate it, have a look at it, make sure it's as real as it's going to be with the limitations that we have within the medium of silicon. I'm by trade an anesthetic technician. I've been working in the peri-op environment for around 20 years, started in about 2001. I've also been the lead simulation technician for one of our national simulation programs here in New Zealand. I'm here today to talk to you about the care and maintenance of our pediatric models. So today I have to show you baby Nina. This is one of our models. Just wanted to go over, like I said, the basic care and maintenance of our babies. Do treat your babies like a real baby. They are fragile, they are delicate, though they are slightly robust in some manners, they're not in others. So we want to make sure that our babies are well looked after they've left us and have gone to you. So one of the things I will mention, obviously silicon is a limited medium with regards to how it behaves. We want to make sure that the digits, obviously these two fingers here particularly, we want to make sure that the digits are well looked after, that you don't trap them in a case while you're trying to put them away for storage, or obviously making sure that your participants are aware of what they're up to as well. Otherwise, you can shear the digits off if you're not careful. So the other thing to talk to you about is the hair on these. Now, Nina here isn't quite finished. We're deliberately showing you one of our less finished models. Nina here still needs a little bit of painting, just to make sure all the pigment and coloration stays where it is. And the hair here, which is just punched in. We don't offer warranty for the hair because of the nature of which it's punched in. It can come out if you are not gentle with it. If you are rough with it and pull it around, the hair will come out. If you're going to be intubating your babies, then obviously making sure that your instrumentation that you're going to be using is lubricated, as well as the baby itself. So I would suggest that before you let your participants near these babies, just take a little bit of lubrication. You only need a tiny amount. All you need to do is just make sure the airway here is nice and well lubricated. So you are able just to pass a finger into the mouth and get right down to the base of the tongue. So there we go. That will hopefully now prevent any damage further inside on the insertion of any instruments that they want to put into the airway. This includes endotracheal tubes that are not sufficiently lubricated as well. Oropharyngeal airways, you can place an oropharyngeal airways in these kids. Again, just being careful as you do, but with that extra bit of lubrication just before you let your participants into the room is an excellent way of maintaining the internals of these babies, making sure that the silicon itself doesn't fry. Silicon as a material can wear away if you keep rubbing at it with non-lubricated items, including plastic and very obviously some of the metal that we use in our laryngoscopes. Do ensure that when you're cleaning the babies, they can obviously be put into a bath of water if you want to, but make sure that no water gets into their mouths or into their airways, as this water will then sit inside the lungs and you can't unfortunately get the water back out once it's in there. The lungs themselves are made out of a spongy material, so they will absorb the water and eventually grow mold, which we don't want. You are able, when you are cleaning the mannequin after use, if the participants have used an awful lot of lubrication, you are able just to go in with a swab and just clean out any of the lubricant that might have been left behind. Preferably something very soft, so it's not going to rub on any of the paintwork, and making sure that you're reasonably gentle with what you're up to, so you don't tear the corners of the mouth or any of the other internal aspects of our wonderful little babies here. If you're unsure that you've got more water, or you're not confident that it's entirely dry, you can use isopropyl alcohol to clean these as well. So cleaning the inside with the isopropyl alcohol will mean that it will evaporate any of the water that's left behind. So ventilation here, Chest rise on these, you will need a decent amount of pressure to get chest rise on them, but they won't behave like a normal baby will. So you will get a slight chest rise, but it won't behave 100% like a normal baby will. You won't get a huge chest rise with a large amount of pressure. You can see here I'm needing to go up to about just over 20 to maybe 30 centimeters of water and pressure to be able to get that decent chest rise out of this model. These don't behave like a normal baby would do on mechanical ventilation as well. So hand ventilation, you will get tactile feedback. You will know when you're over ventilating or over pressurizing what's going on. You will get that tactile feedback. You will get chest rise. However, mechanical ventilation, unless you have a very, very good seal, may have a problem. All right. So again, just to recap, when you're maintaining the babies after use, just try and make sure that the airways are nice and dry before you put them away. You can submerge them in water if you want to clean them, but please, just like a real baby, make sure that the head stays above the water. To clean out the lubrication itself, as you saw, just swipe with a swab, just try and get as much of it out as you can, but be as gentle as you are able to while getting the task completed. And if you do have any concerns that there might be something behind, get an isopropyl alcohol soaked swab and just have a feel around again. That will hopefully dry up any simulated secretions that may be left behind. Be cautious with the hair. It is punched in, so it may come out over prolonged periods of use. We do supply repair kits for the silicone itself. So if you find that over, again, prolonged periods of time, the silicone has become torn or ripped, we can send you out repair kits. There are instructions on our website on how to use these, as well as a YouTube tutorial video. I hope that helps with maintenance and care of our lovely little babies here. Again, treat them with respect like you would do a real baby. Thanks very much for listening. Thanks for your time, and I'll see you again, I'm sure.